Joette, thanks so much for coming in today. It's always great to see you. I wanted a chance to sit down and follow up and get your first impressions. So things are going great so far?
Yeah, I'm just ready to get everything completed.
Perfect. So let's sit down and chat.
Okay, hold on. I'm gonna roll again.
Okay, I'll just sit down. Oh, my favorite chair.
Your favorite chair. So when we started this whole thing, I know that you had a fair amount of apprehension about things. And so tell me, now that we're at this point in the process, how do you feel like things have gone, and how are you doing?
Really well. I couldn't be any more satisfied, seriously, because I don't know why it took me so long, and I did have apprehension, probably just because I heard so many things about, it's such a process, and they're not very natural, or they don't feel natural, and all that. And now it's like, what did I wait so long for? Because my mouth feels so much more healthy. I mean, just overall, I don't worry about my gums or anything anymore like I used to, and they work really well. And all my friends are like, geez, I don't even have bad teeth and I want to get implants. They look at mine and they're like, I'm just going to go do it for the heck of it. But yeah, so with technology, I think it just made it, I couldn't believe the process too, how quickly it went once the gums healed,
Absolutely.
And with technology, I thought it made it so much easier. I thought it was going to be so much of a process, but it really wasn't, It really wasn't.
That's great. That's great. We hear that all the time in terms of, it's interesting because I'm in a profession that, frankly, a lot of people aren't that excited about. But when we can have an experience for a patient that can be truly life-changing, it's so gratifying for us, and we hope it's the same for our patient. So what's it like to get compliments on your smile?
I'm always just kind of taken aback because nobody's ever complimented me on my teeth before. They may look at them and not say anything, but I'm self-conscious, but used to be, but now I'm not at all. And my friends are always like, wow, yeah, those teeth they're new, aren't they? It's like they forget until I smile that I had this procedure done, and so it's fun.
Well, that's awesome.
It's fun.
It is awesome to see you smile, because when I first met you, smiling that big,
I always smiled with my mouth closed.
Would have been the furthest thing from your mind.
Oh, these work so they work just like I had all my original natural teeth in. They worked so well.
That's awesome.
The bite is perfect. I mean, you did all that so well that there's never any looseness, or they don't flop out or fall out when I'm eating anything.
Well, we are certainly excited for you.
I was surprised about how well they work.
What advice would you give to someone in your exact same situation, having the same questions, concerns, apprehensions? What would you say to them now that you're on the other side of things?
I would tell them to at least take the middle road financially, if not more, because there's a lot of people that want to go to like Aspen or Mexico or whatever and save money, and I don't recommend that, because your life is usually, hopefully, longer than you think it's going to be. So you want to do it the right way, I think.
Right.
Because I went to talk to so many other dentists and specialists about this, and you made it easy for me to decide. But by the way, you explained everything so thoroughly to me that it was hands down, this office, because I was so nervous, and the way they rushed me, some people rushed me through and didn't explain things very well, and didn't give me any information to take home and go over, and that's important.
I think sometimes as healthcare professionals, we get into that mindset where if it's something that we do regularly and all the time, we forget that for each person attached to these teeth, this is like a life-changing decision process. And so I I didn't want you to take that lightly.
Yeah, there's a lot of options, you know,
Mhm.
with all this, and you just really explained it well.
Well, that's great, and I know Sheila it was very important to her to take care of you from start to finish. And when you walk in the door, I know Stacy and Sarah and the entire staff. First of all, they look forward to seeing you.
Oh,
And and secondly, they wanted to make sure that we delivered on the experience that you expect and that you deserve.
they totally made me feel comfortable about things. You know, just having them by my side when you were doing procedures and whatnot.
That's
Yeah, they were great.
That's great. What would you tell a patient about the differences potentially between being able to take your case from start to finish in one office with one doctor versus going from here for my surgery, here for my restorative phase, and having multiple doctors involved? How was that experience for you?
Oh, 100% easeful. Yeah, because I thought I was going to have to go to a different guy for molds or whatever you call it. What do you call it?
Different for impressions.
For
different
impressions,
for
for
the
impressions, and then
different
maybe
place for the implants.
right, and
Maybe
it was
a third doctor to do something
or
else.
different doctors. Some places had 2 doctors or something like that. I can't remember, but so yeah, that made me comfortable having just you take care of everything.
I think that's one thing that when we first started doing a lot and getting extensive training in implants on the surgical side, that was a big deal for us to be able to give our patients a way to say, yes, I'm comfortable, let's move forward, let's try to handle this from start to finish here. So
Yes, definitely.
certainly that was a big deal as we were getting started. It's been absolutely a pleasure not only to take care of you, but to get to know you.
Thanks, you too.
Over the course of this time. And so I'm glad to hear that you're doing so well. And I also always like to follow up with my patients, and I think this is an important question. What could I or my staff, what could we have done better for you, or what do you think could have made your experience better, or how could we even do a better job of helping other patients like yourself?
I don't know. You guys were spot on with everything, with scheduling and all that. You worked with me really well with that. Because there was a lot of appointments.
There were a lot of appointments.
But not over the top. I mean, it wasn't too crazy. I mean, you worked with my schedule, so that made it easy. No, I can't think of anything really at all.
Yeah, I think that's a good point that you make.
Scheduling.
Scheduling is important, and I think it's important that you mentioned that. You know, this doesn't. We can have an amazing result that once we're ready to go can almost essentially happen overnight. But it's a process that got you here. But the process that not an overwhelming process, but a process to do it right and do it
exactly
in a stepwise fashion.
Right.
To make sure that we ended up where we intended to end up.
Right. No, I wouldn't want to be rushed through this kind of a process, you know, so.
And I wouldn't want you to be either.
No, and that's what made me feel good, that you were so thorough.
That's great.
It wasn't like going through a fast food dental clinic.
Yeah, well, that's funny
know?
you mention that, because people don't think of a dental office or dentistry in general as being an experience-based business. But we've tried to make this an experience that you can, if you say the dentist isn't my favorite place, at least you're going to say it's not my least favorite place, and that was on balance a good experience in my life.
Right.
Not something that I dreaded or
Right.
couldn't stand to do anymore. So we want you to leave you with that impression that, hey, this is an okay place to be.
Yeah, and you know, it was a little bit time consuming only because the technology is so advanced now compared to how it used to be with just walk in and get a pair of dentures
Right.
and walk out, you know, or whatever.
Was it all worth it?
Yeah. Oh yeah.
That's great. That's great.
Yeah.
Well, I might, since I have you here, I might take a quick look around, take
Okay.
a look, make sure things are doing okay, and if any questions come up while we're doing that, just obviously let me know.
Okay.
And then if you're okay with it, I might grab a picture or two before we let you go, and then we'll have you on your way.
Okay.
Excellent. So Joette, we talked a little bit about, we talked about function and getting you back to function. And I asked you to think back, way back when with your natural teeth, and that we consider that to be like 100% fantastic, nothing better, versus, you know, really having no teeth at all would be 0%. So how would you describe your function after this process compared to maybe how you were way back when, and then how you were when you started to experience some problems?
100%. Because, I mean, even back before I started getting periodontal problems, you know, they were functioning normal, I suppose.
Yeah.
This is how it feels now. So I'd have to say 199 to 100%, seriously.
That's fantastic. That's
Because
fantastic.
it's been so long, anyway, that this feels, definitely feels 100%.
Well, it's overwhelming to hear you say that, because honestly, when I was doing my training and even in dental school with just a traditional dentures, you might say,
It wasn't that well.
it
good.
was not that way. We're talking about, if we could achieve the literature talks about 20% function of natural teeth. So to hear you say, you know what, this is like having all my natural teeth and using implants to help me function, that's great to hear you say. It just means a ton to us.
It's worth every penny and all the time it took, really it is.
That's awesome. That's awesome. Cool. I'm going to take a look around, okay? Is that cool? Thank you so much for coming in today. It's great to see you. I always love the chance to follow up with patients like you at this point when we're kind of all completed, and just to see how things are going and see how you're doing. So it's great to have you here today.
Yeah, it's just going great.
Awesome. Awesome.
Yeah,
Let's sit down
really
and chat.
good. Okay.
All right, Joette, so this is kind of a strange question maybe coming from a dentist, but would you say that's possible for dentistry to have changed your life?
Oh yeah, because I love to eat. And I can eat 100% well now, so yeah.
That's awesome. Our retention's pretty awesome, huh? Yeah, we can stay in foot super well. And most of our stuff wow, that's great.
I'm always.
We're talking like once a year.
Okay.
I'm gonna grab a news here. So you'll know, like, if you feel like that retention is starting to change or suffer, like if you feel like they're not quite as stable, all that means is that little nylon insert is getting, because it's designed to it wears a little bit over the course of time, and we can very easily.
That's good to know.
Yeah. So so we can change those out in a matter of minutes. It's not a process really at all. You actually, what I'm gonna recommend is that I'll have you see our hygienist probably pretty soon, because they'll clean the implants and just like we would natural teeth, and that always gives us a chance to see how you're doing and answer any questions. We can use that as time to change out housings if we need to. Okay.
Give me a next one.
I will. So if I check here. That's how they're supposed to sound. Not like no thud. Nice. That makes sense? So that's great. You're great. I can tell that. But that's the other thing. Typically once at least every couple years, I would just take bones of the implants.
Okay.
If we ever have any kind of issue, we can catch it early on.
Good.
And make sure we're in good shape. We actually have your case. We talked a little bit about risk factors, things of that nature. We actually have your case over-engineered, and that's one of the things that we try to build in was kind of a straightforward, fair, equitable, fee structure, is to allow us to be able to like I said, over-engineer a case. In other words, you've got more implants probably than you technically need, but that gives us some insurance for the future, and we'll always be here to help you no matter what happens. You know,
Good,
that's
yeah.
part of the process is just ongoing relationship. You know, I'll be here for
Good.
you know me with my 7 kids
Yeah,
and my family.
yeah.
You know I'm going to be here practicing
Yeah.
for many, many years, right? So my hope is that you never need another dentist in your entire life, because I'll be around forever and I will take care of you, because building that relationship is a big deal to us, of course.